Something is happening on the surface of your body right now. Something most people look at every single day and explain away as aging, as dry weather, as stress, as nothing at all. But what if that small mark on your arm, that patch of skin that shifted color 3 months ago, or that spot you keep meaning to show a doctor but never quite get around to, what if those things are not nothing? What if your skin has been sending a distress signal for months and nobody told you what the signal actually looks like? The truth is, the skin is the largest organ in the human body, and it is one of the most sophisticated early warning systems biology ever designed. When something goes wrong deep inside, when cells begin to malfunction at a level too small for any scan to catch yet, the skin often knows first. It changes, it shifts, it sends messages in the language of texture and color and shape, but most people never learn to read that language. And the cost of that ignorance, in some cases, is measured in years of life. What I'm going to share with you today is not meant to frighten you. It is meant to give you the kind of clarity that changes outcomes. Because there is a profound difference between a sign caught early and a sign caught late. And that difference almost always begins with a single moment of recognition. The first silent sign is something that sits on the surface of your skin and looks at first glance completely unremarkable. It is a patch of skin that becomes unusually rough or thickened in a localized area, often on the neck, the chest, the upper back, or the forearms. People describe it as feeling like fine sandpaper. They rub cream on it, they blame the soap they switch to, they call it a rash and wait for it to pass. It does not always pass. Here is what is happening beneath that texture. When the immune system senses abnormal cellular activity beneath the skin, it sometimes triggers a localized inflammatory response at the surface. This response is the body's attempt to wall off a problem it is trying to contain. The skin thickens because the underlying tissue is under immunological siege. Chronic low-grade inflammation, the kind that produces no pain, no fever, no dramatic symptom, begins to express itself architecturally on the skin above it. The surface becomes a map of what is unfolding in the tissue below. What makes this sign particularly deceptive is that it tends to appear in locations people do not scrutinize carefully. A patch between the shoulder blades, a section of skin behind the ear, a roughened band across the upper chest that sits under a collar and goes unexamined for months. By the time a person looks carefully at it under good lighting and considers what it might mean, the process beneath it may have been progressing for a year or more. The key distinguishing feature is this. This kind of roughness does not respond to moisturizer. You can apply every cream available, and the texture persists. It may shift slightly from week to week. It may lighten and darken with the seasons, but it does not resolve the way ordinary dry skin resolves. That non-resolution is itself a message. The body is telling you this is not about moisture. This is about something deeper, something operating at the cellular level that no topical treatment was ever designed to address. Science has established clearly that persistent, localized skin thickening without an obvious external cause warrants evaluation, particularly in adults over 50. The cellular activity that drives this kind of change belongs to the same category of dysfunction that, when left unaddressed over time, can progress into something far more serious than a patch of rough skin. Now, before I show you the second and third signs, including the one that clinicians see most often in patients who come in too late, I need to tell you something that connects everything we are discussing today. Every warning sign I am describing exists because of a specific biological environment inside the body, an environment that your body already has the tools to correct, if those tools are properly activated. Later in this video, I'm going to explain a precise protocol called the cellular hunger protocol, which works directly on that cellular environment at the root level. It is the piece most people never hear about. But first you need to understand the second sign, because this is the one that almost everyone sees and yet almost no one correctly interprets. And it is hiding in the most visible place imaginable. I want to tell you about someone who came to my practice not long ago. A woman in her late 60s, retired, attentive to her health in the way many people her age genuinely try to be. She walked every morning. She cooked at home. She had been to her doctor consistently for years, and yet she had been carrying a sign on her skin for 8 months without understanding what it meant. She mentioned it almost as an aside during a conversation about something else entirely. There was a spot on the left side of her neck, she said, that had changed color. Not dramatically, just slightly. It had become what she described as a deeper shade, like a bruise that never quite formed but also never quite faded. A friend told her it was probably hormonal. A pharmacist gave her a lightening cream. She had applied it faithfully for 6 weeks. She had never connected it to anything happening inside her body. When I examined it and ordered the appropriate tests, what we found was exactly what her description had suggested to me. The discoloration was not a surface pigment issue. It was an expression of what was happening in the tissue beneath it. The vascular structure in that localized area had been responding to abnormal cellular activity For close to a year, her body had been telling her the truth every single morning. She had simply lacked the interpretive framework to understand what she was seeing. The moment she understood what she had been looking at and looking past, standing in front of her mirror every day was one of those moments in clinical practice that does not leave you. Not because of what we found, but because of how close she had come to dismissing it past the point where intervention was still straightforward. She caught it. Barely, and only because she finally said the words out loud to someone who recognized them. Hold that story as we move forward, because in every sign I'm describing, the gap between seeing and understanding is where outcomes are determined. And today, we are closing that gap. If this kind of depth matters to you, if you believe that understanding what your body is communicating is worth your time and attention, take a moment right now to subscribe to this channel and turn on the notification bell. What we discuss here does not live in a pamphlet. It is the kind of clinical perspective that accumulates over years of practice, and I publish it consistently because you deserve access to it without needing an appointment to get it. The second sign is the one I urge you most urgently never to dismiss, and I say that knowing you may be tempted to dismiss it precisely because of what it is. Unlike the first sign, this one is invisible to anyone looking at you. It is something only you can perceive, a specific area of skin, perhaps on your abdomen, your side, the back of your thigh, or your shoulder, that regularly feels warmer than the surrounding skin, or in some cases not warmer but oddly sensitive. A heightened awareness of that patch of surface that is difficult to put into words. People sometimes describe it as the sensation that something is there, even when nothing visible can be found, because it is subjective, because it exists only in what a person feels rather than what can be photographed. This is the sign most consistently dismissed, minimized, explained away. The person notices it and files it under strange, under unexplained, under probably nothing. It is not nothing, it is physiology made perceptible. Even at early stages, abnormal tissue growth requires a blood supply to sustain itself. The biological process by which that supply is established involves the development of new blood vessels toward the affected area. Those new vessels bring heat, they bring increased metabolic activity to a localized region. And the sensory nerves in the surrounding skin, which are extraordinarily sensitive instruments designed to detect precisely these kinds of changes at the body's boundary, can sometimes register this thermal and vascular shift before any imaging technology is capable of visualizing it. This is your nervous system performing its most fundamental function, sensing change, alerting the conscious mind that something in a specific tissue environment has shifted. The challenge is that most people have never been given a framework that allows them to translate that signal into meaningful information. They feel the warmth, they notice the sensitivity, and without a reference point, they have no choice but to file it under unexplained and move on. You now have that reference point. If you notice a specific area of skin consistently over a period of weeks that carries a different quality of sensation or temperature from the skin around it, the absence of a visible explanation does not mean there is no explanation. It means the explanation is beneath the surface and it deserves attention. Let me ask you something genuinely. How many times have you noticed something about your body that felt off, something that nagged at the edge of your awareness, and then talked yourself out of taking it seriously because nothing was visibly wrong? Think about that for a moment. The answer to that question may matter more than you realize. The third sign is one that many people actually see, but almost universally attribute to the wrong cause. It is a subtle but persistent change in the skin surrounding an existing mole or pigmented mark. Not the mark itself changing dramatically in the ways you may have been told to look for. Something quieter. A faint halo of slightly different tone developing around a spot that has been stable and unremarkable for years. The surrounding tissue shifts. The skin immediately adjacent to an existing mark begins to look marginally different, sometimes slightly lighter than it was, sometimes carrying the faintest reddish or yellowish quality that was simply not present before. It is the kind of change a person might notice for a fraction of a second while drying off after a shower and then forget completely by the time they reach for their clothes. This is not a cosmetic change. This is the inflammation radius becoming visible at the surface. When abnormal cellular activity accelerates within or beneath a pigmented region, the immune response in the surrounding tissue intensifies. Inflammatory compounds flood the local area in response. The microvascular network surrounding the mark changes its behavior, redirecting resources toward the site of concern, and those changes begin to express themselves in the tone of the skin above them, not dramatically, not overnight, but consistently over weeks and months for anyone paying close enough attention. Specialists trained to identify this kind of change can detect it on examination, but the person living inside that skin can see it too, if they know what they are looking for and they are examining themselves under adequate light on a regular basis. The critical principle here is this: any existing mark that was stable for years and has begun to change in any dimension, whether size, texture, color, surrounding skin quality, or sensation, represents a shift in the biological status of that area. Stability followed by change is the signal. The nature of the change matters less than the fact that something that was not changing has begun to change. Now here's the question that all three of these signs ultimately lead to. Why does this happen inside the body in the first place? Because the signs, as important as they are to recognize, are not the root problem. They are expressions of the root problem. And the root problem is something that science has been studying with increasing precision and clarity. It is the accumulation of what researchers describe as dysfunctional cells. Cells that have lost their capacity to operate correctly, that no longer respond to the body's regulatory signals, that persist in tissue long past the point where they should have been identified and cleared, and that generate chronic low-grade inflammation as a constant byproduct of their dysfunction. This cellular debris, this accumulation of what some researchers have called zombie cells, creates the inflammatory biological environment in which the warning signs we have discussed today are generated. This is not simply aging. It is not genetic inevitability. It is a specific, measurable, addressable failure in the body's cellular maintenance system, and here is where conventional approaches consistently fall short. Most interventions target the visible problem. They work on the expression of the dysfunction. They address the surface, and that is precisely why the same warning signs return in patients who seem to be doing everything correctly. Because the underlying environment that produces those signs has never been corrected. The biological mechanism that exists specifically to address that root environment is one your body already carries. It did not need to be invented. It needed to be understood and activated. It is called autophagy, from the Greek words meaning self-eating. It is the process by which your body systematically identifies, dismantles, and recycles cellular debris, damaged proteins, dysfunctional cellular components, the precise category of cellular waste that accumulates over decades and drives the inflammatory environment we have been examining throughout this entire conversation. When autophagy functions at its designed capacity, the body maintains a cellular environment that is dramatically less hospitable to the kind of dysfunction that generates warning signs on the skin. When it is suppressed, which is the default state for most adults following a modern lifestyle, the dysfunction accumulates without resistance. The reason autophagy declines over time is not mysterious. It is suppressed by the metabolic environment of constant feeding, chronic inflammation, and the absence of specific activating compounds that were once present in traditional dietary patterns but have largely disappeared from what most people consume today. The mechanism is intact. The activation signal has been lost. The cellular hunger protocol was built around a single foundational insight, that the body, given precisely the right conditions, already knows how to perform cellular maintenance at a level most adults have not experienced since early life. What is missing is not a drug, not a surgical intervention, it is the activation signal. 4 specific morning activators, all of which exist in an ordinary kitchen, that when combined and timed correctly, shift the body's metabolic priority away from heavy continuous digestion and toward the cellular cleanup work that restores the tissue environment from the inside out. Over a 30-day cycle, the protocol creates the conditions for autophagy to operate fully. The inflammatory cellular debris clears. The signals that produce the skin changes we have discussed today decrease because the biological source of those signals is being systematically dismantled. The tissue environment that generates dysfunction becomes progressively less hospitable to that dysfunction. People who have completed the protocol describe changes that begin within the first week. A quality of morning clarity that had become unfamiliar, a reduction in the physical heaviness that accumulates across the day, a return of physical ease they had stopped expecting to feel. The science underpinning this is not theoretical. Autophagy research represents one of the most rigorously developed areas in modern cell biology. The discovery of its regulatory mechanisms was recognized at the highest levels of scientific achievement precisely because of how fundamental the process is to cellular health across a lifetime. Research has consistently demonstrated that individuals with robust autophagic activity maintain lower levels of the inflammatory markers associated with abnormal cellular proliferation. The relationship between cellular cleanup efficiency, inflammation reduction, and the prevention of the kind of dysfunction that produces warning signs on the skin is one of the most well-established connections in contemporary biomedical science. What has been missing until now is a practical translation of that science into something a person can implement consistently within the context of an ordinary life. No specialized equipment, no clinical procedures, no radical restructuring of everything about the way they live. The 4 morning activators in the cellular hunger protocol provide precisely that translation. They require only the decision to use them correctly for 30 days. I want to be direct with you about access to this protocol. The limitation is not fabricated, it is structural. The activation sequence must be calibrated to the individual's current metabolic state because the 4 activators do not produce the same effect in every body at the same starting dosage and timing. The calibration requires individualized guidance, and the number of people who can receive that level of support at any given time is finite. The current cohort is approaching capacity. I've seen what happens when people who needed this protocol delayed their decision. They return weeks or months later, and the inflammatory environment that was producing the warning signs they recognized has continued operating in their absence. The dysfunctional cellular accumulation does not pause while a decision is being made. Every week of delay is a week in which the tissue environment that needed to change remained unchanged. The people who moved quickly were consistently the ones for whom the 30-day cycle produced the most complete results. That is not coincidence. That is the biology of timing. If you have been watching this and recognizing something in what I have described, whether in your own skin, in a change you noticed and set aside, nor in the situation of someone close to you, the most important thing you can do right now is act before this access window closes. All the information about how to begin the cellular hunger protocol, including the current availability for new participants and the full details of the activation sequence, is in the pinned comment below this video. Go there now, read it carefully, and make the decision while the access is still open.